Well, hello, everybody. Welcome again to our weekly podcast. This is our podcast called Start or Sit. What we do here is we talk about the previous week's NFL injuries. And is that player who maybe suffered that injury, sustained that injury, is that player going to start or sit in the up-and-coming week number 6? Dr. Hawkins, how you doing?
I'm doing wonderful today, Shannon. How's everything for you?
We're living the dream. The Seahawks had a bye that last week. I think they go this week again. I think they're traveling, aren't they? Am I wrong or right? I haven't looked at the schedule, but I know they're back in action. And do you know where they're playing?
I don't. I've got December circled on my schedule because the Eagles are coming to town.
Oh,
so
right.
that's the game I'm getting excited for.
Yeah, that's right. Eagles. 49ers, they are looking pretty tough. I think there's two. How many 5-0 teams going into week 6 is there? I know the Eagles are 5-0, 49ers are 5-0. Is there anybody else out there that's 5-0?
Yeah, I don't think so because Bills stumbled and the Chiefs have stumbled. So, yeah, I think that's it for right now.
Yeah. I like doing this podcast because it gives me a good excuse. Well, I always like watching football. Sundays in the fall and the winter are great, but this gives me even a better excuse to watch it because I like to keep an eye on things. And we're going to start out here with a guy, oh boy, this guy is all over social media. He's in Facebook. If you're a Swiftie, you know this guy. This is Travis Kelce. And Travis Kelce, in the game the other night, he came out of a break. It was very benign. He came out of a break, went down. First thing I thought, I'm sure you thought the same thing, Dr. Hawkins, ankle sprain, one of those inversion sprains. Remember, he went out, and then they took him in, they took x-rays, he came back out, he wanted to run in. The coaches stopped him, but he played. Tell me what you think's going on with this guy, this special guy, Travis Kelce.
Yeah, it was a good one because they're keeping the camera on him all the time, so you get to see him, and they you saw it. The ball wasn't even coming his way. He just kind of pushed off, his foot inverted or turned in underneath him, and he had that classic sort of low ankle sprain injury pattern. So, again, we've discussed the different levels of ankle sprains that'll happen, but the fact of the matter is, they get that x-ray to make sure that it doesn't look like there's anything off with regards to the bony alignment, any small avulsion fracture, and then essentially test him out, tape him up, and get him back out there. So he's been rehabbing it. He's been held out a little bit of practice so far, but I think he's going to be a play this week. Again, they'll probably tape it up pretty tight, but and he may lose a little bit of mobility, but that guy's got such good hands. He's got great size to screen off defenders, and so if you've got him on your fantasy team, I think he's definitely a play.
Yeah, it's kind of interesting because we're only in week 6 here, and he is a big-time player. The way I look at it, the Chiefs don't move unless Kelce's. They don't move good unless Kelce's in the game. There's night and day difference between him being out and him being in. At least that's what I'm looking at. But he's most likely going to play. I would agree. Keep an eye on him though, because if he re-injures that ankle, he may sit a little bit just to save him for the remainder of the season, kind of like things. So we'll watch Travis Kelce. All right.
Yep.
James Conner, running back. This guy's a pretty prominent running back for the Arizona Cardinals. I'm thinking they say he's got a knee injury. He's out. They're talking about putting him on IR, if I remember right. Correct me if I'm wrong here. If you go on IR, that's an automatic 4 weeks. So they're talking about that. So he's probably got a ligament thing going on his knee. Wouldn't you think that's the case?
Yeah, he had a non-contact injury. He was planting and twisting. So the fact of the matter is, with 4 weeks out, that's probably 90% of the time going to be an MCL sprain. Mm-hmm. That's sort of the time course for your sort of grade 1, grade 2 injury in a skill player who has to really twist and pivot. I think if he was a lineman, they wouldn't have put him on injured reserve. They'd probably have him back in 2 weeks with a hinge brace on his knee. But in his case, he is a big, they're a bad team. Yeah. But he is a huge part of their offense. And so I think their idea is we're not very good. We'll just take him out completely, let him heal, and have, some productivity later in the season rather than risk turning it into something more. So he's obviously being on IR, definitely won't play him this week. And I think as long as he responds well to, the rehab, I think he should be coming off of IR and back in 4 weeks. Yeah,
good point. Just out of curiosity, I'm thinking that most likely it's an MCL, but just for our listeners, the reason we're thinking it's an MCL is because they're putting on, I mean, they're assuming IR 4 weeks and he's going to be better. But if that was like an ACL, I mean, he would be out for the season. That's why we're thinking the MCL, and it's a common ligament to get hurt with running backs when they cut and they get that, what we call valgus, or that medial stress. So that's why we're thinking MCL and not things like ACL or anything else. That's what we're thinking together, right?
Yeah, exactly. And the other thing, some people would question, maybe it was a meniscus injury, that cushion cartilage between the ends of the bone. But again, in that situation, he might go on the IR for the 4 weeks, but they would already be talking about doing surgery to clean that up. And since there's no talk of surgery, it's usually that extra articular ligament injury that can heal on its own with just protection in time.
Right. That's something, I mean, you just mentioned an injury that we see quite frequently in football, stopping, twisting type injuries. That's a meniscus tear. We just haven't heard that. We'll have to keep an eye out for any meniscus tears in the season here. Amon-Ra St. Brown, this is a wide receiver. Detroit Lions, I mean, they are on fire. This is a team that's been in the cellar for how many years? I think they used to put shopping bags over their head when you're a Detroit fan. These folks are on fire. He's a big part of it. Wide receiver, abdominal injury, kind of what I probably would call a strain. But let's talk about that versus this sports hernia thing we hear about.
Yeah, and this is always a tough one because I think these things kind of blend into each other. We used to, when sports hernias first came out, it was really meant to be sort of like this deep injury, sort of in the pelvic floor, which is sort of different than a typical hernia where it's a problem where there's a soft spot that allows essentially your abdominal contents to push out. So the sports hernia was this pelvic floor injury where the muscle pull caused a tear there. And so it was painful, caused weakness. What you're starting to see now is you're seeing that all these areas kind of blend into each other because there's deep attachments of the muscle, what's called the fascia, and it overlaps. And so the good news is they're saying he's feeling better and they expect him to come back out. But I'll put a little warning out there for everybody who's got this guy. You use your abdomen to stabilize your core, and you use it for everything, to tighten up, to take a hit, to spring and push off the ground, to jump in the air. And this could blend over into something that's more of a sports hernia. So even though they're calling it an abdomen injury, I think he is a super productive guy. He's their number one wide receiver. I think it's Reynolds is the number two guy there. But they rely on him a lot. So if he can play this game, I would play him. If he can play this game and he doesn't leave the game, then I think you're dealing with just a simple muscle strain injury, just kind of like what you and I would get if we tried to actually do like 100 sit-ups. The next day we'd be like, I can't move because my muscle hurts. But that's a muscle strain. Yeah.
Yeah. I was just thinking about that. It's been a long time since I've done 100 sit-ups. I got to be honest. But, I remember when I was younger working out and you did this abdominal workout, in the next 2 days, you couldn't even get in and out of your car. You couldn't even walk. Your core, you can't even cough. I mean, your abdominal muscles. Can you imagine if it's irritated or sprained? But we're thinking it's most like we're going to keep an eye on it. We think it's an abdominal muscle, which are interesting muscles in the first place. A little irritation there. Keep an eye if he completes the task or the game, and we'll keep an eye on him for this sports hernia. That sports hernia, that's become, I think probably, I don't know, I mean, what your thoughts are, but I've been a therapist for 35 years. I think the sports hernia is something that was probably undiagnosed for many, many years, and then the technology advancements in diagnostics, because there's a couple places. Isn't there a surgeon like on the East Coast that's where all the big players go? I mean, there's some specialty care there.
Yeah, there's a couple of guys. There's a guy, his last name's Kelly. He's in New York City, who does a lot of these. And there's it's an interesting thing because it's such a vague diagnosis that actually it's really, really hard for like regular people to get it treated, because insurance companies a lot of times don't even recognize it as an injury. And so a lot of these, the athletes get it treated, but a normal person, a lot of times, they end up having to say, well, am I going to pay to get this taken care of out of pocket, which is unfortunate. But it's a burgeoning area. It's one of those ones where I don't think we've found exactly what are the injuries that definitively need surgery or don't need surgery. You know, if you've got a cracking goalie who does the splits and tears his adductors off, that's pretty obvious. That guy needs that operation to reattach that pelvic floor area. But like if I pull my groin, I might have some type of a tear in that area, but is it worth, exploring it and suturing it up, or will that heal up on its own? So
yeah, I mean, anything in the pelvic floor world's come a long way. Me being a physical therapist and having several physical therapists that work for us, that's a big service we offer is pelvic floor physical therapy, because your pelvic floor is made up of muscles, right? And when they become weak with childbirth or injured, I mean, you can rehab them, and that pelvic floor is pretty important for a lot of functions, so to speak, right? Okay, so
yeah, I think what you guys have learned and developed, like I said, that's what points us to kind of figuring out probably a fair number of these rehab very well now that we know how to do it and where we're working on things.
Yeah, right, exactly. Okay, here we go. Hey, Anthony Richardson, quarterback, Indianapolis Colts. I think they had a win last week with their backup, Gardner Minshew, go Cougs. But Anthony Richardson had to come out of the game. This guy's got a grade 3. Man, this makes me feel pain right now. Grade 3, acromioclavicular AC joint irritation, separation. Man, he's pretty much done for a little while, isn't he?
Yeah, I mean, this is probably their worst nightmare because, it's a relatively significant shoulder injury on the throwing shoulder.
Side. Yeah.
Yeah, so that's the real gray area here. So they've already put him on injured reserve. They are not talking about surgery right away. So I think obviously their idea is let's see what happens as the soft tissue settles. Interestingly enough, when you grade these injuries, the idea of a grade 3 is usually based on the x-rays. So it's how elevated the end of the collarbone looks in relation to the acromion. So that indicates that there's been damage to these supporting ligaments. Apparently, his x-rays were normal, and they didn't actually come up with this sort of grade 3 designation until they did his MRI. So what that tells me is that they saw damage to what's called the AC joint, but they also saw fluid or edema in what are called the coracoclavicular ligaments, which are the supporting ligaments underneath it. But evidently they're probably not completely torn. So his x-ray didn't show the collarbone sitting up high. So that's why I think it's probably an MRI diagnosis to be called grade 3. But since his x-rays, didn't show that elevation, they're hopeful that the soft tissue scarring will just allow that to heal, because even though you can reconstruct those ligaments, once you start to do operations on a throwing shoulder, all bets are off.
Yeah.
So as far as stiffness, mobility, function, all those things are a lot harder to recover from. For every Drew Brees who just destroyed his shoulder early in his career and made an amazing comeback, there's a ton of people that their careers ended, after a big shoulder injury and surgery.
Yeah, this AC joint. I mean, the biggest thing about this, having personally experienced an AC joint in my lifetime, I mean, it's the pain. It's the pain. It just takes forever for the pain to calm down. And then with the grade 3, you have a deformity. There's a little bit of a piano key step off there, or whatever you want to call it. But I mean, he is going to be out. I would guess. I mean, with the throwing arm, even if he held up, I mean, you think 4 to 6 weeks at least? Yeah,
the last I heard was, they said 4 at the
minimum
low end, but up to 8 at the high end.
I'm guessing the high end. If they're calling it a grade 3, I'm going to guess the higher end. But he is out right now. Minshew is in, so we will keep you posted and updated on Anthony Richardson. He's a rookie. I mean, he's had a tough go because he was just out 2 weeks ago, I think, or not long ago with a concussion, wasn't he? If I remember,
you kind of start to get. Yeah, you start to get shades of Cam Newton here.
Oh, yes.
He was big and strong, and just tried to just body himself around. And you can pay the price for that in that position.
I tell you what, I mean, what I've noticed this year is, for those general managers out there that invest in an offensive line, I mean, it's pretty important. Look at Brock Purdy. I mean, that guy's on fire. He's the last pick in the draft. Came out of Iowa State. Man, he's on fire, but he's got this offensive line. He doesn't really get he doesn't really get touched much. And then, what is it, Daniel Jones from the New York Giants the other night? I think he was sacked 9 times or something. I mean, yeah, you got to protect that quarterback. Justin Jefferson, wide receiver. Here's another team that's kind of struggling. And I like Kirk Cousins. I really do. Hamstring strain. Actually went out of the game, I don't know, in Sunday's loss to the Chief. I think he went out in the second half, but he was limping around the sidelines. They were talking about, how they had to get in the ball. He's a big part of their offense. He made a couple catches, and the next thing you know, he's limping off with the hamstring strain. So this is one of those soft tissue injuries, and tell us what you think he's going to do.
Yeah, he's clearly got an intramuscular tear. They MRI'd him and saw that, the attachments on the top and the bottom are okay, but they did put him on injured reserve. So again, a situation where those soft tissue injuries, he's going to need some time to let the tissue heal, then work on getting his flexibility and his strength back, and really being proactive with his therapists to recover. I don't think they've folded up their season yet, so I think they're just doing this, hoping that 4 weeks allows him to come back at 100%, and hopefully they can solve their problems. Because they were such a good team last year. Obviously they did well, but they had a lot of close games that they won, and this year they're losing all those games. So, it's a tough injury for him. He's a great guy.
Yeah,
he's a real star in the making for them.
Wow, yeah, he's amazing. Yeah, they were just. I mean, it was kind of interesting just watching the game. The announcers, like I said, were just talking about how he needs to get involved. They need to get Justin Jefferson involved. He caught a couple passes. The next thing was going out. Now he's on the IR, going on the IR. If you place a player on the IR, you're kind of confirming they're out at least 4 weeks. So fantasy football folks out there, Justin Jefferson is out for 4 weeks. That's what we know right now. Last player. This guy is on fire. I'm going to say his name as De'Von Achane. Achane, our producer here, Jensen, he knows how to pronounce these names, and he's telling me it's De'Von Achane, okay? Is that right, Jensen? Yeah. He's shaking his head. We got it. Running back. Tell me real quick, I want to ask you a trivia question. This running back, Miami Dolphins, Dr. Hawkins, where does he stand as one of the leading rushers? What number in the NFL right now do you think this guy is? On the top 10 NFL rushers, where is he at?
For the season. Wow. I know that he's leading in yards per attempt. He's over 12 yards per attempt right now. So I got to imagine he's in the top 3.
Yeah, he's number 2. That's good job. See, not only are you a good sports medicine doc, you're a good prognosticator. And predictor there.
Yeah,
yes,
there you go.
He is number 2 behind. Who's he behind? Who do you think is he behind? Little trivia here. San Francisco running back on fire.
Oh, McCaffrey. I should know McCaffrey. I got him on my fantasy team. He's why I'm successful.
Yeah, so. Exactly. Yeah. That's right. Okay, this guy's got a knee. This is another one of those knees. We're thinking, since they call it a knee, and I think he is going to be out a little bit, possibly. I think they're talking about 4 to 6 weeks. So I think you and I are both probably assuming, just like the running back Connors there. James Connors with the knee. This is probably an MCL sprain, one of those ligament things. Let's talk about him.
Yeah, he just had a lot of contact during the game. He continued to play, but they started to use him a little bit less later in the game. And he was, this is clearly our injured reserve week. He was also put on IR. They have a lot of depth with a lot of weapons in Miami. And I think, they've got Raheem Mostert ahead of him, who's been doing well. So, and it's interesting. I'm interested to see if McDaniel can turn around Chase Claypool coming in. So, we'll see if they're able to kind of get enough time for him to recover, but he'll be out, another MCL injury.
Yep. Yeah. Out he's on IR, so he's out for 4 weeks. So again, fantasy football players, he is out. That's De'Von Achane, as Jensen told me. He is out for 4 weeks. And that is our players for week 5, and we're looking forward to going into week 6. So we're going into week 6 right now, already 6 weeks in an NFL season. Boy, I tell you what, I don't know, Dr. Hawkins, have you been watching a little bit? Man, there is a lot of people that are going out. I mean, the other night I was watching a game, and they were saying they're down to they have 2 people left in their secondary that aren't injured. I mean, it's a tough game, isn't it? I mean, it's a high contact, high velocity, strength, quickness, speed. It's amazing what these athletes go through in their bodies. You can see why we're always talking about injuries. I mean, we don't
Yeah, and as you know, we don't even touch on the defensive side.
I
But
know.
yeah, the defensive injuries are huge this year.
I know.
TJ Watt dislocated a finger.
Yes.
There's like a lot of stuff going on.
Yeah.
So, but yeah, it's that's why they carry huge rosters, obviously.
Exactly.
But once you get into your third and your fourth string, you're obviously going to drop off with your efficacy and stuff like that.
Right.
So, some of those games were getting ugly. You get that Green Bay Raiders game,
Yeah.
and, it's just not it's fun to watch, but you're not seeing like the highest level play sometimes.
Yeah, exactly. Here we go. I'm Shannon O'Kelley, physical therapist, and he's Dr. Hawkins, orthopedic surgeon, specialist, sports medicine specialist, and we are out for our week 6 starter sitting. And everybody have a good week and a good weekend, and we'll see you next time.